have a look at this clinical question. Okay, time's up. I've launched the poll. I'll give you a few seconds to select your answer. While you're doing that, just a quick reminder of the scenario that you've just read. So essentially, you've got an adult patient. That's important because the diagnostic criteria are different for adults and children. And even within children, the age matters. So they're 19. And you can see they've got symptoms that fit with asthma. So we're sending them for objective lung function tests to confirm the diagnosis. So one of those tests is FeNO. Type into the chat if you know what FeNO stands for. And what we're looking for is what's the threshold to actually confirm a diagnosis. All right, so in terms of the answer options, the two popular answers, the most popular one is C, 40 parts per billion, followed by B and E are the other two that were very popular. But the most popular one by a significant margin is C, 40 parts per billion. Okay, so the correct answer is E. So just under a quarter of you got that right. So most people didn't get this right. The most popular answer, as I said, is C. And for those of you that picked that, don't worry, there's a good reason why you picked that. 40 parts per billion was the threshold in the old guideline. It's been changed, that's why we're covering it, okay? In the new guideline, the threshold for adults and 17 plus for the diagnostic purpose is considered adult is 50 parts per billion. It's increased. So the old threshold for 17 plus was 40 parts per billion. So, you know, if you just haven't had time to read the new guideline, it's only very, very fresh. It's not even been 2 full months yet since it was published. That's okay, don't worry. Okay, that's why we're here today, right? 35 parts per billion, which was the other popular answer, that's actually the threshold for children aged between 5 to 16. And that hasn't changed. That was the same threshold in the old guideline for 5 to 16. It stayed at that threshold. But for 17 plus, this was the old threshold. The new threshold is 50 parts per billion. Okay. So let's go through what are the positive test thresholds on this objective lung function test. So FeNO stands for fractional exhaled nitric oxide. So basically, this is a sort of quite relatively new. It's been used since the old NICE guideline. So, it's been around for quite some time, but relatively new if you think about how long we've been diagnosing and managing asthma. But basically, it's a useful aid to have an objective measure to diagnose asthma. So what it does is you have these FeNO devices. They measure, when they're breathing out, the amount of nitric oxide in the breath of patients. And that's a biomarker for asthma, basically. So it can give an indication of the level of inflammation in the lungs. So 35 parts per billion of FeNO in that exhaled breath is the threshold for children aged 5 to 16. Under 5, you can't use these tests. You basically look at symptoms, and then there's a way that you can make a diagnosis. We'll talk about that later, okay? But for older children, 5 plus, and then for 17 plus, which for the diagnostic purposes is considered an adult, it's now 50 parts per billion or more. That's the new threshold since the new combined guidelines. Then you've got bronchodilator reversibility testing. So here, if you've got 17 plus, you're looking for two things. That the FEV1, so that's how much air they breathe out in the first second of breathing out, is at least 12% improved from when they, you do it before they have the bronchodilator. then you give them the bronchodilator, you wait about half an hour, then you do it again, right? So you're looking for at least 12% improvement, all right? Or 10% or more of predicted FEV1, either predicted based on their age and gender and height and things like that. As well as that, so the FEV1's got to improve, but you've also got to have an increase in volume, so lung volume, of at least 200 mils. That's for 17 plus. For 5 to 16, you don't need the increase in lung volume, and that's because in this age range, the height can be significantly different, so the lung volume is going to change a lot anyway, from when someone's 5 to when someone's 16. By the time someone's 17, they're reaching their peak height, and it's enough that you look for this 200 mil increase. So for 5 to 16, all you're looking for is that improvement in FEV1, or that 10% or more of the predicted FEV1. Then another alternative is peak flow variability, at least 20% variability. And then finally, direct bronchial challenge. You can use two things for this, either histamine or methacholine. The threshold is the same. You're looking for a PC20 of 8 milligrams per milliliter or less. Most of these were all in the old guideline. What's changed is the threshold, the adding of the 10% of predicted FEV1 as an alternate. These two haven't changed. This is new, completely new in the new guideline. And that is that if you've done all of those and you're still not sure, then you might think about skin prick testing. So you're looking for house dust mite or IgE levels and eosinophil count for 5 to 16. So if the skin prick test is negative and IgE is not raised, then that's a negative confirmation of asthma. If the skin prick test is positive or the IgE is raised, then you also need to look at the eosinophil count. And if that's also increased more than 0.5 times 10 to the 9 per liter, then that's, in the new guideline, a confirmed diagnosis of asthma. Okay, this one isn't done routinely. You'd normally start with this and potentially this. As part of doing this, if you're going to do bronchodilator reversibly, you're doing spirometry, so you'll also check this. If these don't give you the answer, then you might move on to direct bronchial challenge. If that doesn't give you the answer, then you might go on to skin prick testing and IgE levels. Okay. Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.